Good evening. Victoria's COVID battle has now claimed 26 lives following the deaths of an elderly man and woman. Case numbers have spiked, 270 new infections, prompting fears of stage 4 restrictions. 1,000 extra defence personnel have been called in. Some will even ride in ambulances beside our weary paramedics. Despite this, Melburnians keep thumbing their noses at the rules, including a wild party in Point Cook. Andrew Lund leads tonight's coverage.
80-year-old Abdullahi Gulid is Victoria's latest victim of coronavirus. The Flemington man died overnight at the Royal Melbourne Hospital. He was buried today, but his sons in COVID isolation were unable to attend.
This is a wicked enemy. It is so wildly infectious. It moves so fast.
A woman in her 80s also died in hospital, taking the state's death toll to 26. Today, Victoria recorded another 270 cases of COVID-19, the second highest daily increase since the pandemic began. 13 cases have been reclassified. The net increase of 257 takes our total to 4,224.
We haven't turned the corner yet. I hope to see that this week, but there are no guarantees.
28 of today's cases are linked to known outbreaks. 242 are under investigation. And with 1,803 cases currently active in Victoria, McDonald's has joined the list of companies requiring staff in Melbourne to wear masks, while no one was taking chances at the tower blocks in Richmond. The continuing high numbers raising questions about even tougher restrictions.
They are all on the table. Further restrictions need to be considered. We can't rule anything out if there aren't sufficient mechanisms to drive down transmission. We would do the minimum required because we know how much of an imposition it is on businesses, on people's lives.
If we see patterns that are worrying and alarming unfolding, then we won't hesitate to take further steps.
But that's considered unlikely, at least this week. 11 cases have now been linked to the Lamana supermarket here in Essendon. And with the number of outbreaks growing by the day, contact tracing is becoming increasingly difficult. The government's confirmed the deployment of 1,000 Defence Force personnel to help with testing and contact tracing, as well as helping to crew the state's ambulance fleet.
One member of Ambulance Victoria, so an AMBO, and a member of ADF, that'll be a General Duties ADF person, who can support the inevitable number of paramedics who will finish up having to quarantine, having to isolate.
And today, a grim reminder those extra troops are joining a life or death battle. Andrew Lund, 9 News.
The front line of the COVID fight, our hospitals, are now busier than at any time during the pandemic. Brett McLeod is at St Vincent's Hospital. Brett, new records continue to be set.
Yeah, Pete, after that first peak back in March, it looked like a lot of facilities being put aside in hospitals like this one wouldn't be needed, but increasingly they are. Have a look at today's figures to start with. First of all, the overall number of active cases has now jumped up again to more than 1,800 right now. Of course, not everyone will need hospital treatment out of that, but increasingly a number of people do. Today there are 85 virus patients in hospital. Yesterday that number was 50. 26 people are in intensive care. That's gone up 9. Interestingly, that includes one man in his 30s and 4 people in their 40s, and 21 people are currently on ventilators. Now, Professor Brett Sutton says based on the amount of people testing positive, he expects those numbers to go up significantly in the days ahead.
There's often 10 to 20% of all coronavirus infections who require hospitalisation, so that's a couple of hundred individuals at least who'll require hospitalisation in the next couple of weeks.
Healthcare workers are, of course, the frontline troops in this, and every day we're seeing small numbers get infected themselves at various major hospitals and other facilities. But it does add up. Collectively, the number of healthcare workers who've been infected is 342, and right now more than 100 have coronavirus. So that means them and those close contacts around them are being taken out of what's an increasingly big COVID fight. Pete?
Brett McLeod reporting. More than a dozen aged care residents who've contracted the virus are receiving treatment at the Royal Melbourne Hospital specialised COVID ward. As Curry-Ann Greenbank explains, up to 80 people from 24 active nursing home outbreaks are now infected.
Heather Matthews celebrated her 94th birthday in lockdown. Now even stricter rules apply at Estia Nursing Home in Coolaroo as health authorities grapple with growing outbreaks across aged care facilities.
Mum understands this, that it's best for her and for the rest of the residents trying to keep isolated in these crazy times.
Up to 80 people are now infected with active outbreaks across 24 aged care homes. Those of greatest concern are Menarok in Essendon with 26 cases, Estia in Ardea with 15 positive tests, and Glendale in Werribee with 13 linked cases. One of them, Alf Jordan, died on Friday.
But the real concern in aged care is that residents have very high mortality rates in outbreaks.
To protect our most vulnerable, the Royal Melbourne Hospital has set up a specialised COVID ward just for aged care patients, and all infected residents from Menarok have been taken there.
It's appropriate that we do have those wards set up, such as the one that's been set up at the Royal Melbourne to deliver that additional intensive nursing support.
But there are now calls for those remaining residents to be evacuated.
There's an insufficient number of bathrooms for each remaining patient or resident to have their own facilities. I just don't see how we stop further cases unless residents have the option to move out.
Unlike Menarok, other aged care facilities haven't transferred infected residents to hospital, but the Chief Health Officer says he's confident that decision won't lead to more infections.
I don't think it's always the case that patients in aged care, residents who test positive, need to be transferred. Sometimes the safest place for them is to remain in that facility.
As long as they can follow all the proper hygiene areas, I'd be happy for them to stop where they are, as long as that is the safest place for them.
And Karianne is in Essendon this evening. Kari, some residents at aged care facilities are still waiting on results.
Well, that's right, Pete. There's been a lot of testing across aged care facilities both yesterday and today. Some of those test results have come back, but we're still waiting on today's results. Some good news tonight for 94-year-old Heather and her family. She's been given the all clear, but there's an anxious wait ahead for a lot of other families. And also a blunt warning tonight from health bosses. More people will die if aged care workers do the wrong thing and go to work when they're sick. Pete?